A major campaign to protect millions of children and people with long-term health conditions from potentially deadly flu has been launched. Public Health England said more than 500,000 more children are being offered vaccination, with the programme being extended to those in school year 3. Flu can be particularly dangerous for those with long-term health conditions, including chronic respiratory disease, such as chronic obstructive pulmonary disease, bronchitis or emphysema, heart, kidney or liver disease, chronic neurological diseases, like multiple sclerosis or cerebral palsy, and diabetes. Professor Dame Sally Davies, Chief Medical Officer, said, "Flu can be much more dangerous for children than many parents realize, and when children get flu, they tend to spread it around the whole family. Every year, thousands of children have flu and it is not uncommon for them to be admitted to hospital. The single best way to help protect your children, and the rest of the family, is to get them vaccinated. For most, it is just a quick, easy and painless nasal spray." The Stay Well This Winter campaign, SWTW, launches today with the biggest ever flu vaccination program in England for children. This year the program is being extended to those in school year 3, offering more than 4 million children protection against flu, around 600,000 more than last year, as well as offering protection to these children aged 2 to 7 years. PHE said the vaccine will help reduce the spread of this infection to the most vulnerable in the community, particularly younger children, the elderly and those with long-term conditions. Children aged 2, 3 and 4 can now get the vaccination from their GP. The school vaccination program will start this week, with parents of children in years 1, 2 and 3 being asked permission for their child to get the free nasal spray vaccination at school. A survey showed that nearly 4 out of 10 parents of eligible children are unaware of the nasal spray. Children are most likely to spread flu to others, so experts believe targeting them helps protect the wider community too. It is estimated that several million people get flu each winter, leading to more than 2,000 NHS intensive care admissions across the UK last year. Reducing transmission by children can potentially help cut the number of GP appointments and unplanned admissions for children and adults, reducing winter pressures on the NHS. People with these conditions are eligible for vaccination because if they get flu, it is more likely to develop into a serious illness, which could result in admission to hospital. On average, someone with a long-term condition is 11 times more likely to die if they get flu than those not in at-risk groups. The risk of death varies by condition, with patients with chronic liver disease 48 times more likely to die on average than those without an underlying health condition. There are around 6.8 million people with a long-term condition in England under 65 years of age. The campaign is also encouraging pregnant women to get vaccinated against flu. Pregnancy naturally weakens the body's immune system, and so flu can cause serious complications for the mother and her baby. The free vaccine is offered to other groups at particular risk of infection and complications, or liable to spread it to those at risk. Anyone aged 65 and over, residents of long-stay care homes, and carers. Those eligible should contact their GP, pharmacist or midwife, as appropriate, to arrange vaccination. Last year 12.4 million people were vaccinated overall in England. Professor Paul Cosford, Director for Health Protection and Medical Director at PHE, said, "Vaccination is the best protection we have against flu, which can cause severe illness and even death among those most at risk. This group includes pregnant women, people with a long-term health condition and older people. I would encourage everyone who is eligible to get vaccinated to help protect themselves and those around them. It is important to get vaccinated every year. Flu is unpredictable and previous year's vaccinations may not protect you against the types of flu virus circulating this year. This comes after it was revealed an unpredictable strain of flu virus could be behind 12-year spike in deaths." Watch more videos at video.5la.net.